28th July is World Hepatitis Day. What is hepatitis? Hepatitis is the inflammation of liver. What are the causes of hepatitis? Hepatitis can be caused by certain drugs, chemicals, toxins, alcohol and viruses. Today we are mainly concentrating on the hepatitis caused by viruses. There are 5 types of viral hepatitis: A, B, C, D and E. Each of these hepatitis is caused by a separate virus. For example, hepatitis A is caused by hepatitis A virus, B is caused by hepatitis B virus and so on. So why are we concerned about hepatitis? Throughout the world, there are 3.5 crore people or 350 million people who are suffering from this disease. And 9 out of 10 people who are suffering from the disease are not even aware that they are suffering from this disease. There is about 11 lakh people who are dying because of this disease. And this disease can be prevented if good awareness is there. So today we are trying to spread an awareness on the causes of this disease, the prevention of the disease, and if it is detected early, how we can save the patient's life, and early detection and immunization for this disease. What are the symptoms of hepatitis? Usually the patient feels fatigue, that is extremely tired. Then they pass dark colored urine or yellowish urine. They pass pale colored stools, whitish stools. Then they have flu-like symptoms, and also some people will have pain abdomen or abdominal pain. So they develop jaundice, that is yellowish discoloration of the eye and skin, and also they have decreased appetite. They don't feel like eating, and also there will be weight loss. Now, how are these viruses spread from person to person and how do we prevent? Hepatitis A and hepatitis E is by fecal-oral route. That means the stools of the patient who is carrying this infection is contaminated with either the food or water, and it is ingested by the patient or person who gets this disease. So what we should do: wash your hands properly after using toilet, and good sanitary measures, and cook meat and meat products thoroughly, and try to avoid uncooked meat and also fish. Then next, hepatitis B and C. These viruses are spread by direct contact of the blood or body fluids of the infected person with the person who comes in contact. So this usually spread by sharing razors, blades, scissors. Then in drug addicts who take the same syringes, and tattoos, people who get tattooed, and also people who get body piercing done. Or it can also be spread in hospitals through blood and blood products. And it is very good to get these blood and blood products screened. And is there an immunization or vaccine available for this hepatitis? Yes. For 2 of the hepatitis, that is hepatitis A and B, there are vaccines, and this has to be taken in time, and if taken, this prevents this disease called hepatitis. And what is the general progress of this disease, hepatitis? So once there is inflammation of the liver, the next stage is fibrosis or stiffening of the liver. If it is untreated, it further goes into a disease which is irreversible, called the cirrhosis of the liver. And further, if it progresses, it can lead to the cancer of the liver called the hepatocellular cancer. And still further, it can cause complete hepatic failure and finally death. That is the reason the awareness of this disease and prevention is very, very important. And the World Health Organization has a goal to eliminate this disease by 2030.
Get vaccinated for hepatitis B, it prevents liver cancer.
Hepatitis can't wait.
Hepatitis testing can't wait.
We can't wait for a world without hepatitis.
Hepatitis treatment can't wait.
Action cannot wait for hepatitis. Hepatitis patient cannot wait for treatments.
Get your baby vaccinated on the first day of the delivery of the kid.
Together we can make it happen.
We will all work together to
body